organized by IOGT-NTO Sweden in collaboration with WHO. And we're very happy to see all of you here today, as well as online. And my name is Sarah Heyman, and I will follow you through this afternoon of seminars, presentations, and our discussions. But first of all, I'd like to leave the floor for Eva Lindh, from Socialdemokraterna, who together with Larry Söder from Kristdemokraterna are our hosts today. And you have invited us to be able to be here at the Swedish Parliament. So, Eva.
Thank you very much. And on behalf of me and Larry Söder, that unfortunately couldn't come, we want to warmly welcome you to the Swedish Parliament and to Sweden for those who have come to this country that we parliamentarians. And this is a very important seminar for all of us here, but also for all of the Swedish population and people around the world, because alcohol is actually affecting us all in one way or another. And I've been a social worker for nearly 20 years, so I know what alcohol can do and how abuse can affect people. And now as a parliamentarian, of course, I still have a lot of interest in this, but also I'm a chair of the Welfare Committee in the Nordic Council. And there we have responsibility also to prevent and work to alcohol policies that are better for people. So I just want to say that and warmly welcome, and this will be very interesting to listen and see. Thank you.
Thank you. Thank you. You know, we should be halfway to reach the Sustainable Development Goals by now. As you know, we're not in many areas. We're not, and alcohol harm actually negatively affects about 14 out of 17 Sustainable Development Goals. But that means that alcohol is an obstacle when it comes to the economic dimension, the social, as well as the environmental dimensions of the Sustainable Development Goals. But at the same time, and this is the good thing, that is that if we use the proven and effective alcohol policy, we could as well actually boost the possibility to reach the Sustainable Development Goals. And that's why we are here today, and that is why we have this mini conference during these 3 days. During these days and today, we will discuss and try to understand the negative harm of alcohol and how alcohol affects both the individuals and society. But we will also discuss how different barriers still exist to reduce alcohol-related harm and which best practices that we can actually learn from each other and use and implement. And to help us out, we have 4 speakers, and that will give us some short presentations from 4 different angles. And I want to welcome our speakers and our first speaker, Sven Andréasson, who is professor at Karolinska Institutet. And you will talk about the second-hand effects of alcohol. And I would say that all 4 of you have extensive knowledge when it comes to alcohol issues, but from, as I said, 4 different angles, and that will be interesting to hear more about. So Sven, please take the floor. I'll help you with your presentation.
Fine, thank you very much for inviting me to do this presentation. And my immediate instinct was, hello, alcohol policy. This is what it's all about, secondhand effects. So policy regulation of alcohol around the world largely is driven by the secondhand effects of alcohol. So this will be familiar terrain for most of us. And we're standing in the Swedish Parliament, and this is a slide on the declaration of the new government 16 years ago, right-centered new government, who gave their declaration of what they wanted to achieve. And interestingly, they wanted to do something about alcohol policy. And this is a translation of the Swedish. So they say that to reduce the consumption of alcohol is urgent, not least because it is often contributes to violent crime and abuse. Reducing alcohol consumption improves public health and reduces many social problems. So there you have it. It's a high political priority because it affects so many other parts of politics. And Sweden is an interesting case. In a way, it's a kind of an alcohol policy laboratory where we've tried all kinds of things, and we have good statistics in Sweden. So these curves are highly correlated, and one is the sale, the official registered sale of alcohol for 150 years, and the other is the rate of homicide throughout history. And you can see how closely interlinked these two are. The exception is the latter decade where consumption does not seem to follow assaults, but that is because those years Sweden opened up for private importation. So a lot of people brought their alcohol from abroad, reducing the officially registered consumption. A classic study was done by David Nutt, English professor, where he compared the harms, the direct harms and the indirect harms for different substances, and where alcohol comes out clearly as the most harmful substance, especially in terms of harms to others. And looking at this, it's one impression is that this is so wide reach. It affects almost everything, doesn't it? So here is a brief division into 4 categories of harms. One is obvious, safety and health. You get hurt, the trauma and accidents and so on. But then you have the societal effects, which we'll hear more about soon. This is about crime and the judiciary system. We have effects on children and families, and not least fetal effects. And they tend to be downplayed, but they're enormously expensive in terms of harms to the families and to the society. So a few words about children. We estimate that about 380,000 children live with a parent that is a high consumer of alcohol. Not all of them are dependent, but they're high consumers. And these children are really at risk in so many ways, and enduring risks. It's not just a temporary problem. They do much worse in the school system than other kids. And they have a much higher risk of developing alcohol use disorder, like their parents, a 4-fold increase. And they have a 3-fold increase in early deaths before the age of 35. So the impact of their parents drinking is quite extensive. Productivity, the largest part of the cost to society is reduced productivity. There are a number of other categories as well, but this is the largest. For one thing, it increases mortality in those years when you're typically most productive, and it increases the risk of unemployment. And it both increases absenteeism when you're not at work, but also presenteeism when you're actually at work but impaired, causing problems of different kinds, accidents and other problems. And this impacts the co-workers to a large extent. The issue of alcohol and violence is well known. This is a report from WHO about 10 years ago, stating that there are important links between alcohol and violence across all cultures. This is not typical for any Swedish phenomenon or European. It's the same all around the world. And again, it's a very widespread spectrum of issues that alcohol causes. Again, the obvious physical effects, but less obvious the mental effects of having been exposed to violence at some point causes long-term impairments on psychological health. Sexual and reproductive health, again, not so well known, but strongly correlated with violent events. And chronic disease. These people who have been exposed to violence turn out to be more susceptible to chronic disease, such as cardiovascular disorder or cancer or stroke. Interesting illustration of the mind-body connection, isn't it? We did a study in Stockholm some years ago addressing the violence part. So it's well known that alcohol in bars tend to increase the risk of violence. So we tested in this trial training bar staff to deny service to impaired customers. This was unheard of before. It's on the legislation in most countries that you're not allowed to serve people that are intoxicated. Usually nobody cares. But in this case, we had a project where we taught the staff, and we also increased supervision from the county council and from the municipal council and from the police. What we found was a decrease in sales of alcohol to impaired people, and as a consequence of that, a reduced rate of violent assaults. We could compare the intervention area, which is a little north of here, with control area, a little south of here. And the control area showed a continued slight trend increase of police reported assaults in these areas, whereas in the intervention area, we saw a distinct decrease. So we saw a reduction in assaults by 29%. And this turned out to be highly cost effective. We spend a lot of money in terms of what prevention usually costs, but the return was enormous. So violence and trauma is extremely costly to society, and there are ways to deal with it. So the main question then, what can we do to reduce these secondhand effects? Well, obviously, reduce alcohol consumption. And this then can be done in a number of ways. And just recently, this volume came out, the third, or I'm not sure the number, third or fourth edition of Alcohol and Ordinary Commodity, which is an excellent source for knowledge in all kinds of parts of society. And this is basically what WHO has been driven the last couple of years, a SAFER program. These are five strong components, the best buys, if you like. It's price, it's the physical availability of alcohol, it's drink driving countermeasures, marketing and what can be done about marketing, and brief advice in healthcare. And price then. Price is by far the most effective component in this catalog. And here's a fantastic study done about 10 years ago by Alexander Wagner and colleagues, where he looked at the effects of increasing price or decreasing price on a number of outcomes that we are interested in. Violent crime, child maltreatment, sexually transmitted disease, sexual assaults, partner violence. And you can find evidence that alcohol price affects all these in careful research. A surprising supporter of this view comes from the OECD, who found that if you want to boost economic output, raise alcohol taxes. There's strong logic in this. We actually had a finance minister some 15 years ago who said it's better that people work rather than drink, because he advocated increasing the price of alcohol. The physical availability of alcohol, we have the term density of outlets. And again, there's extensive literature on all these outcomes that we're concerned about, and the density, how easy it is to access alcohol in a community. One very Swedish typical response here is the retail monopoly, which has been questioned over the years whether it actually makes an effect. So we had a group of international researchers looking at this and looking at the decisive factors in alcohol sales, and the number of outlets, the hours of sale, the pricing, and promotion and advertising, where a retail monopoly with a public health mandate clearly has a possibility to reduce and affect all these driving factors. And looking at history and other countries that have done similar things, we could calculate what we could expect if the monopoly was disbanded. An increase in consumption by some 30%, and an increase in alcohol attributable deaths by over 1,000. Strong effects. So to conclude this brief presentation, as a doctor, I like to show this picture, that alcohol affects every part of the body. Over 200 diagnoses that are related to alcohol consumption. So that is the basic message. And this calls then for a much stronger effort from the medical system to ask about alcohol consumption and intervene. We're not doing a very good job at that as it is now. But the second part is the community level. Again, alcohol seems to impact all parts of society, not just the social services or the health sector, but pretty much everything: law and order, productivity, transport, education, etc. And here too, we need a stronger policy effort response. So thank you very much.
Thank you very much, Sven. And many of the things that you have been talking about today is to be found also in a report that you wrote together with some other experts within the field about the topic that you talked about today. And the name of the report is
Alcohol and Society.
Alcohol and Society. So that's to be found on the website of IOGT.se, I think.
Yes.
So thank you very much, Sven, for your presentation.
Thank you.
And then we'll welcome Lisa Klefbom, who is a policy expert at the Swedish Cancer Society. And Lisa, you will talk about the linkage between alcohol and cancer. So Lisa, welcome.
Thank you. As already said, I work as a policy expert at the Swedish Cancer Society, Cancerfonden. I mainly focus on the area of prevention. And today I will talk a little bit about alcohol as a risk factor for cancer. Well, this look a little bit different, but the Swedish Cancer Society works to beat cancer through financing the best cancer research in Sweden. We finance research, we fundraise, we inform and support, and we drive advocacy. We have raised approximately 1.3 billion euros during the 70 years since we were founded, which not only makes us the largest charity organization in Sweden, but also the largest fundraising organization in the Northern Europe. We often say that cancer is a disease that affects everyone in one and another way. 1 out of 3 gets cancer in life, but it's not only the person that gets sick that is affected. Next to every cancer patient is a family member, friends, and colleagues, which also are affected by that cancer diagnosis. What we also know is that more and more people are affected and are diagnosed with cancer. Today, over 60,000 people in Sweden gets cancer each year. That is more than the double from the 70s. We are expecting that number to grow up to 100,000 people by the year 2040, so not so long from now. And one of the reasons for this is that we are living longer, and cancer is a disease we get as we get older. But a big part of the reason is also that more and more people are diagnosed with cancer linked to our lifestyle. We are living an unhealthier life today than we did in the 70s. In Sweden, 3 out of 10 cancer cases are preventable. And there are 6 risk factors that is linked to our lifestyle habits. For many years, it has been well known that smoking is a risk factor of getting cancer. It's also well known that unhealthy sun exposure is causing several cancer diagnoses every year. But in later years, we have also learned more about what we eat and drink and how that's affecting the risk of getting cancer. The connection between alcohol and cancer has been known for long, but the evidence field has grown in later years. And now we know that even a small amount of alcohol is at risk of getting cancer. Food habits, physical inactivity, and an unhealthy weight is also risk factors of getting cancer that we know more about today. Overweight and obesity is linked to several cancer forms and are predicted to pass both smoking and sun exposure as a primary preventable risk factor in the future. And as I said, all these risk factors are preventable. This means that as a society, we can affect how many people are affected by these risk factors and the risk of getting cancer. And due to this and the fact that more and more people are diagnosed with cancer, we need to have a society that are preventing cancer. We are looking to a future with a growing cost due to the number of growing people getting not only cancer, but all non-communicable diseases. And as I said, the connection between alcohol and cancer has been known for long. In Sweden, alcohol consumption causes 1,300 cancer cases each year. There is no safe level of alcohol consumption for cancer, and this includes all alcohol beverages. The risk of developing cancer increases substantially the more alcohol is consumed. And some examples of cancer forms that has a strong connection to alcohol is the oral cavity, liver, colon and rectal cancer, and breast cancer, also shown in the picture above, even if the name is in Swedish. And what we also know today is that the public's knowledge about the connection between alcohol and cancer is limited. Few people know that even a small amount of alcohol are a risk for cancer. And worth repeating, cancer caused by alcohol consumption are preventable. Alcohol attributable cancers and death can be prevented by reducing alcohol consumption. The Europe's Beating Cancer Plan has a goal about limiting the alcohol consumption and to support member states and stakeholders to reduce alcohol-related harm. The effects of alcohol consumption are large in Europe. Within the WHO region, about 180,000 cases of cancer and almost 92,000 cancer deaths were caused by alcohol in 2018. And if we look at this map, we can see that the rates of cancer in Europe caused by alcohol. And this is one of the reasons why EU saw the importance of including alcohol consumption in the cancer plan. If we look at Sweden, we have one of the smallest rates of cancer cases, and we are light green compared to other regions where the alcohol consumption is higher. And when you talk about risk factors of getting cancer, it's also important to talk about the individual versus the society. And this is a picture we often show to illustrate the responsibility between the society and the individual. My health and my lifestyle is not only my choice. The society has in every way both a responsibility and an opportunity to create conditions for individuals to make healthy choices. For example, the choice to ride the bike to work is my own, but of course, it will be much easier to do so if there are safe paths to ride on and a good infrastructure. And it's the same with alcohol consumption. The choice to consume alcohol is my own, but if we limit the availability to alcohol, it will affect my behaviors. And that is what this picture illustrates. The society's responsibility, basically meaning politicians, has the responsibility to make this easier for everyone to walk upon, so that everyone can carry the responsibility for our own health. And a way to show this responsibility of the society, Cancer Fund last year published a report about what policies we have in Sweden to prevent cancer. And the report is based on this model, which is from the World Cancer Research Fund. And in the middle, it says prevent cancer, but it could have said healthy population. With a comprehensive policy approach, we can not only prevent cancer, but all non-communicable diseases and create a good public health for all. The model has 3 categories. It's the yellow one, which aims to engage action across sectors. It's the pink one, It's about behavior change communication, like education, counseling, support, and information, basically supporting individuals. And then we have the health enhancing environments. And this, I would say, is about what we do to make it easy to live healthily. The society's way to flatten the hill. It could, for example, be fiscal policies like alcohol tax. It could be marketing regulations, creating alcohol-free environments. And to prevent cancer, all of these fields needs to be filled with policies. And in the report, we evaluated which policies we had on different risk factors to prevent cancer. And we combined policies to alcohol and tobacco. We combined the policy of alcohol and tobacco together because they stand for 13% of all cases of cancer. And here you can also see the gaps and what we found in our evaluation. And what we could see was that the smallest gaps in the area is due to Systembolagets monopoly. We have effective policies in line with cancer prevention model in Sweden. If we look at alcohol, thanks to the monopoly restricts access to alcohol through rules that affect numbers of stores, where they are located, and when the stores are open. But it also limits the possibility to market alcohol products at point of sales, for example. The result of this leads to a strong policy to promote healthy social planning. We do have policies in one and another way in each field of the model, especially if we look only at alcohol, which is not the case in this picture. But still, there are some gaps that needs to be filled even in Sweden. Where we could find gaps is in the fields of marketing and labeling. The public's knowledge, as I said before, of the connection between alcohol and cancer is low. And we think it's important that people know about the connection between alcohol and cancer. And therefore, we need to put health warnings on alcohol products, like other countries are about to do. One other policy we need to implement in Sweden is to limit the possibility to market alcohol products in social media, which is allowed today. And I would like to end with, again, saying that the society needs to create conditions that makes it easy for everyone to live healthily. This is done by a comprehensive policy approach where we look at all aspects of the society. If we look at alcohol consumption policies in Sweden, we are in a good way. We have a comprehensive policy and society that holds back alcohol consumption. The case is not the same if we look at policies to prevent cancer caused by overweight and obesity. It is in this area we find the large gaps in policy, and at the same time we're getting more and more cancers caused by overweight, and the amount of children with obesity and overweight are rising. And this, in a very specific way, shows how important it is with policies to prevent cancer. We are already standing in front of a great challenge with a large rise in cancer cases. To prevent cancer is one of the most important ways to tackle this. As I said before, 3 out of 10 cancer cases are preventable, and alcohol is one of them. This is why we need a public health-oriented and a comprehensive policy. And I will encourage you all today to keep this in mind. Thank you.
And I mean, we talked about the Sustainable Development Goals before, and we have really strong goals when it comes to reducing the number of NCD cases in the world. And then, of course, looking at alcohol policy is one way of doing that. It's important. Thank you very much. Very interesting. Mike Dinger, who is the Director of Strategy and Advocacy at Movendi International. And you will talk about a theme that is very close to my heart as well, that is highlighting alcohol as an obstacle to development. So welcome, Mike.
Thank you so much, Sarah. Good afternoon, everyone. Great to see you. And this is a fantastic opportunity to talk about the potential of alcohol policy solutions in Sweden, in Europe, and in the world. And Sarah, you have already shared some of the information that I have prepared here. And there's a reason why we have worked on this issue for many years together. It's so nice to see you here again. So I want to use a few minutes to talk about alcohol as an obstacle to development. Development, what does it mean? Is it the low and middle income countries in East Africa or Southeast Asia where you have worked for so many years? Or is it outside Stockholm or maybe in southern Sweden? And of course, the SDGs, as many of us know, they are for all people, for all countries. And what I want to show you is really based on what Sven already introduced, what Lisa talked about. We can address alcohol as an obstacle to development, and in doing so, we can unlock potential in our communities, for our people, and in our societies. So, Sarah, you know all the points on this slide. In Movendi International, we have analyzed the Agenda 2030, so all the Sustainable Development Goals, all the targets that are there, and our analysis shows that 14 of 17 of these development goals are negatively affected. The second point, Sarah also already mentioned, 14 of 17, what does it mean? Does everyone here know the 17 SDGs by heart? No. But if we talk about it in the second point, alcohol negatively affects all dimensions of development. We have already seen the economic and the social dimension, and I'll show you a little bit also the environmental dimension. And that is also where the potential of alcohol policy solutions comes in. One fact that Sarah hasn't mentioned, so I'm very happy that I have something new to tell you, is the one for me on the right-hand side. Alcohol is the #1 risk factor for disease burden in the young population. I think it says there 25 to 49. What does that mean? It means that our societies, Sweden, Sri Lanka, United States, we all make investments in our children and young people. It's the kindergartens, it's the universities. And when we are ready to contribute economically to our communities and societies, alcohol harm comes in and undermines society's investments, undermines human capital, social capital. That's what it means here. And so that's why Sven had these, I think, staggering facts about the economic loss from alcohol. The other two facts, simply said, show that it's not going the right direction with addressing alcohol. Alcohol's contribution to the global burden of disease is rising compared to other risk factors. So countries are doing better on some factors, are not doing enough on alcohol. I think that includes Sweden, and that includes many other countries, my own home country, Germany as well. This is a fact that Sven has talked about, I think, excellently. So I just want to put it into context. So the secondhand effects of alcohol harm, what does it mean? And I think it's really interesting to compare it to tobacco, because tobacco societies are addressing rather well in an evidence-based way, but alcohol we are not addressing. And we can see here the total harm. So if we combine the direct effects of alcohol with the indirect effects, the total harm of alcohol is nearly double that of tobacco. But of course, the policy response from our governments is not nearly as close as how we are addressing tobacco harm. Sven also talked about children. So what does this mean? The children are affected. Secondhand effects, women, for example, children. It means that we are having suffering children in our school classes, in our football teams, in our communities every day. It means that our governments have a responsibility, actually a human rights responsibility, to protect against that kind of suffering. And it means that we have the tools and we are not deploying them properly. Sven showed some of the tools as well, and Lisa had it on this really nice circle. I promised to talk about the environmental dimension. It's maybe the first new thing I'm saying right now. And we have just listed it. If you go through the Sustainable Development Goals and the environmental dimension, we are talking about pollution, we are talking about the climate crisis, the greenhouse gas effect, and alcohol is a big contributor. Actually, the entire value chain of the alcohol industry is a big contributor to our climate crisis. The glass bottles of beer and wine, they are really bad for our climate. The whole distribution of alcohol is really bad for our climate. And there is something that is on top of the slide that I want to show you. This slide is not coming, I'm sorry, but I wanted to show you a quote from a local group in South Africa. They are saying, They are exporting our water in the form of wine. Here in Sweden, we have wine marked as sustainable in Systembolaget, but in South Africa, the people don't have drinking water. Or in northern Mexico, we have beer breweries using up all the drinking water. People don't have water to drink and they develop diseases. That is a reality because wine production, beer production is incredibly water intensive. So we have a global justice dimension here in this environmental harm that alcohol is causing. And last but not least, the economic effect. Overall, across the world, 2.6% of GDP are lost because of alcohol. Sven showed, I think, for Sweden, it's 2%. So Sweden is rather close. That just shows that there is lots of potential in alcohol policy for our economic sustainability. I think Sweden, other countries would like to have these 2% of GDP. That is economic growth that we are losing, and economic growth in times of financial crisis. We're just coming out of the pandemic. So to wrap it up in the words of Movendi International, Sven has showed it, the science is getting ever better. WHO is recommending the alcohol policy best buys. We really know what works. Members of parliament, members of governments who want to take their human rights responsibility to protect people and communities from alcohol harm, they can really do it, and it can really have a significant effect. Sven showed some of these curves that I think are really illustrative. So alcohol policy holds vast and untapped potential for promoting development. And development then means human potential on the individual level, community resilience on the wider, societal development, economic growth. All this is untapped potential that we can unlock with alcohol taxation, banning advertising, and reducing alcohol availability. Thank you so much.
Thank you for a very good presentation, and you really wrapped up what you were talking about before, but also broadened the perspective. So thank you very much for that. And I think we'll really keep in mind what you all three have told us during your presentations further on for the panel discussion. But before that, we have now I will need some help with the technique. Emil's already there. Thank you. We will have the presentation online as well from Vesna Kerstin from the WHO Executive Board.
Hello, everybody. Do you hear me? Hello?
Yes, we can hear you, Vesna.
You can hear me. Fine. I'm talking to you here from Slovenia. I'm very honored to speak to Swedish parliamentarians, and you should know that I'm half Swedish because my mom moved to Slovenia in the 60s. I always lived in Slovenia, and to be honest, there are some differences between Slovenia and Sweden, and those differences are in particular in alcohol policy. And I understood this already when very little, when I was reading Emil I. Lönneberga book, where even the pig had to go to sobriety meeting because of eating the cherries with alcohol. So here I am, and I would like to talk to you, having a long history myself of working in different public health areas as public health professional, civil servant, recently also Director General of Public Health, and being cooperating with WHO a long time. I would like to talk mostly on alcohol policy, not that much on alcohol, but you have heard a lot by Lisa, Mike, and Sven on alcohol as such. The topic you have chosen today seems to be one of the most challenging for me as public health professional. For many years, in particular in Southern European countries, where we produce wine, beer, and liquor, we were publicly discussing benefits of alcohol use rather than harms. We were referring to tradition and culture and only slowly progressed in areas such as drinking and driving. It's getting better. Last year, the regional committee of WHO European region, an important progress has been made. European countries, all of our countries, adopted a very progressive action plan, making it very clear that it is not about harmful use of alcohol that needs to be reduced, but it is about consumption itself, consumption of alcohol. There is no safe limit, we have heard. Also science has proven, and I think Lisa has mentioned it, alcohol is a substance that should be controlled in a different way than ordinary commodities. Consumers should be appropriately informed and on harms and those most vulnerable, such as children and young people, pregnant women, people with chronic diseases and mental health problems, including addiction, should be discouraged in all possible ways from drinking alcohol. There are simple solutions, and they were mentioned, such as ban on advertising, labeling, taxation, and limited access. And Sweden is given a very good example with restrictions in sale and monopolies. High prices are often a challenge for governments, especially for my government, bordering other countries like Croatia, but also bordering Austria and Italy, where the prices of alcohol are still low. Advertising is nowadays a much bigger problem than before because of social media and the power of social media to manipulate consumers in a very subtle ways and away very often from public eyes, even children. So alcohol is a legal substance, we all know, and it is legitimate for alcohol industry, while not very considerate in terms of benefits for society, to strive for higher sales and promote its use. And that is the fact. While alcohol is legal, you know, there will be producers legally producing alcohol beverages, and they, of course, will strive for higher sales. It is on the governments and parliaments to adopt regulation and ensure control to limit the damage that was mentioned by all three presenters before me. There are some good practices there, including the one mentioned from your country, on monopolies, but we are also facing many failures in alcohol policy when decisions were not based on scientific evidence and were biased by interests of the industry. Let me share with you two examples from my country and one from international arena as well. Slovenia is beer, wine, and spirits producing country. Alcohol policy, despite a decent regulation on access, age limit is 18 and restrictions are there on hours of sale, has always been a challenge. A strong lobby of producers and considering ourselves proudly as a wet culture were hindering progress. We did, however, progress in the area of drinking and driving, in particular with young people, investing in NGOs that work with young people, but also investing in regulation for novice drivers. We were also very proud of the ban existing from former Yugoslavia to sell alcohol on sport events. So selling alcohol on sport events and indeed advertising it was not allowed. We were taken by surprise when not even a month after Heineken bought our beer producers, the proposal was tabled by parliamentarians to allow alcohol back on sport events. Public debate was very intensive, and the Ministry of Health and experts and NGOs at the end won the debate and prevented changes of legislations, but not for long. Very soon, another proposal was launched, this time with an idea that local sport clubs would be the ones selling the alcohol during events, and in this way, earning the money for their actions, their activities. They would be even licensed for this, and that would sort all the possible harms that could be related to this kind of arrangements, we were told. We completely underestimated the power of local and regional governments on national politics and lost the battle in the parliament. After more than 20 years of keeping alcohol away from sport events, it was brought back. Very soon, local clubs realized that others are much more skilled in selling alcohol at sport events than they, and complained about not profiting from this new legislation. But unfortunately, it was too late. The arrangements, the legislation is still there, and we are now looking for windows of opportunity to get the legislation right and back again as it was before. The other example is showing in the same direction. Slovenia was allowing farms and families and individuals to produce 600 liters of wine and 500 liters of beer for personal use per year, and not being registered and paying excise tax. Despite a proposal to change this, that was actually supported by bigger producers based on the argument that this production represents unfair competition to those big producers, legislation has not changed due to a very high number of families in Slovenia producing wine or beer for so-called personal use and representing a big share of voters as well. As we were told by big producers, trying to change this and trying to actually influence the agriculture Ministry for Agriculture that is in charge of this legislation. They didn't succeed, and health sector didn't succeed either. So these are the two national experiences that we had, and I wanted to share them with you because while we all know how harmful, and it was also explained by the two presenters before me, alcohol can be, it is very difficult to get it on the political agenda and to adopt stricter measures. We have to compete here with the industry, and they are very skilled in getting it right in the parliament. Another thing that happened actually in the regional committee of the WHO in Israel last year was the pressure of wine producers on the Ministry of Health in France, but not only the Ministry of Health, they were actually making pressure on the diplomacy in Geneva to go against the proposal that I mentioned before that introduce consumption as a goal, reducing consumption of alcohol as a goal instead of harmful consumption as a goal. The diplomacy was challenged by Ministry of Agriculture, and they pushed for not adopting this law, the French ministry. Fortunately, the representation of France from health side was very strong, so we got it right in the regional committee after long discussions and long exchanges of views in the corridors, so that the new action plan of WHO finally was supported. But this is how it happens. And it's very different to tobacco policy, because tobacco policy and control is backed by not only national legislations, but is backed by international legislation such as Framework Convention, and also at EU level we have many directives that actually regulate products. This is not the case in alcohol. It was mentioned before, you know, the labeling. France indeed has adopted small little pictorial labels that, you know, alcohol is harmful to women that are pregnant. But when we wanted to introduce this in my country, we were not successful. And actually, alcohol is one of the few products that you cannot really read on the bottle what is in the bottle there yet. So it seems very important that decision makers understand a broad context of alcohol policy as it was presented before me, and are not challenged unprepared by argumentation focusing only on one aspect. Holistic approach and understanding the impact of increased consumption of alcohol, not only on health, but also on, as we have heard, sustainable development, environment, alcohol-related violence, absenteeism production is vital. And here I will stop. I'm looking up to Sweden and their regulation in alcohol. We are always referring to your monopolies, and we'll follow what you do next. Thank you very much.
I don't know if you can. I don't know if you can.
I can hear you badly, but I close down my microphone.
Not anymore, but okay. Thank you very much, Vesna Kerstin, and thank you for, I think.
I'm here with you.
Yes. Here we go. Thank you for highlighting the need of learning from each other between the countries, and not least to implement and look at the new action plan for Europe. Thank you very much also for the reference to Astrid Lindgren and to Sweden, and as well to the temperance movement, which was the place where Eric and his pig went. Thank you all for these very good presentations, giving us a very solid foundation for the panel discussion. So I will now welcome our members of Parliament, Ulrika Westerlund, Jakob Olofsgård, Karin Rågsjö, and Karin Sundin. Anders Jonsson. And yes, another chair. I'm so happy you're so many. So, again, Jakob Olofsgård from Liberalerna, Karin Sundin från Socialdemokraterna, Ulrika Westerlund från Miljöpartiet, Karin Rågsjö från Vänsterpartiet och Anders Jonsson från Centerpartiet. Very welcome. We have to squeeze together today. Okay, so you have your microphones on. You're familiar with the system? Yes, perfect. Okay, so we'll have now half an hour of panel discussions, and you've all been able to hear these presentations beforehand. And we'll start with a short question and a short answer. I'll give you 1 minute each to give your reactions to the presentations we have just heard. And I would also like to know whether you think that what was presented is known by public in general and among politicians. So I think we'll start with Jacob.
Yes, I have to switch to English in my brain. Thank you for a very good presentation, all 4 of you, absolutely. Directed for this, how much of this is known by people in Sweden?
And among politicians.
Politicians.
As well.
Hopefully we reflect the country.
Yeah.
And I think it depends. It varies very much in Sweden. We have people who know very much about it, and people who don't almost have any knowledge about it at all. So it's a big difference in Sweden about the knowledge of this that we have heard of today. And that reflects what we're going to talk about this later. Some people have good knowledge and handle it in a good way. Some people who don't have good knowledge and don't have the possibilities and efforts to handle alcohol's problems are very bad. it varies very much. I think.
Thank you very much. Karin, what are your reactions to the presentations?
Well, I think the presentations were interesting, very condensed, and says a lot about the problems that we're facing. And I think in general that the questions presented today is known on a aggregated level. I think we know that alcohol is not good for us, it's not good for the society, but in detail, I think we have much more to learn. For example, the question about the connection between alcohol and cancer, I think we have to discuss and debate that much more because it affects everybody's life. And we have a lot to gain by continuing to discuss the alcoholic problems. And I think as politicians, we should talk about health issues and environmental issues, but I think most important is that we start talking more about the economic costs about this, because politicians, we understand the economic facts, and we haven't discussed this enough, and I don't think we understand the impact of alcohol abuse on our economics.
Thank you very much. Ulrika.
Thank you, and thank you for the interesting presentations. Do you hear me? Maybe now? Yeah, it's can only one mic at a time, apparently. Thank you for these presentations, and I'm going to echo a little bit what my colleagues just said, that of course the overall knowledge I think is known among the public and among politicians, but not the details maybe. I didn't know, for example, this somebody stated that the alcohol harm was nearly double that of tobacco. That was not known to me. And this, how much alcohol causes cancer, I don't think is known in general either. That I remember having a discussion with a friend of mine a couple of years in a bar, where I said, you know, alcohol causes cancer, and just like, never heard. So you have heard many things, maybe you know that it's not good for you, but you don't know the details. And also, I think there's lots of confusion. I tried to Google for a new recommendation that I recently heard, that the recommendation was basically don't drink alcohol at all. Because as has been said by many of you also, that there is no safe limits that you can like safely consume alcohol. So the recommendation is don't drink it. And then the comments and what was mainly reported in media was this is unrealistic. So there's no point in having such a recommendation because that's unrealistic. And I tried to Google for this to remember where that recommendation came from. I didn't find it, but then I found numerous other recommendations over the year. And I think this causes confusion, of course, because every time there is a new study, it's reported quite, I don't know, super, like not so much in detail in media. So everybody can Google and think, oh, as a woman, I can drink 10 standard glasses a week, and that's not a problem. And then I found something else that said nobody under 40 should drink anything at all. It's only for the older people. And then something else, oh, what you think 10 standard drinks, that's not as much as you think, really. So it's in reality 5 standard drinks. And then on the other hand, don't drink it at all. So this, of course, causes lack of knowledge and confusion among everyone, I think, politicians included.
And different recommendations within all the European countries as well, so that adds to the confusion, I would say. So, Karin.
Thank you for the presentations. I got a small cold, so maybe coughing a lot. You know, to be prepared. Right now, I think it's a challenge, really, in these questions. I feel that we talked less about the whiskey drinking for adults in general in Sweden and in the world, as to say. Examples of how alcohol can be associated with cancer, for example. How many is that in Sweden, in Europe, in the world? I don't know. I believe that the risk discussion must fade away for a number of years. In Sweden, I must say, I can see that it's very obvious. A number of the parties talk more about the lack of availability of such a difficult word of alcohol, and less about the risk.
and the perspective and all these risks. So I think we have to do something about it from our view. Thank you.
Thank you, Karin, and Anders.
Well, I'm sorry I missed the first presentations. It would have been interesting, especially to hear Sven, concerning these questions. I've followed it for several years now, and what is new in the debate and the research is the linkage between cancer and alcohol. That was not focused 10, 15 years ago, and that is something that I don't think so many people know about. It's important to have that discussion and also to see if that can be included in the recommendations for the populations in Sweden, have that in a very clear way. About the other presentations, all the negative effects of alcohol is well known, and also the last presentations from Slovenia really underlines what a positive development we have in this country. I think that is something to be very proud of. We have a good situation, especially a decrease in alcohol consumption for many, many years, especially among young people, but also in the population as a whole. What wasn't in the presentations, I believe, if it wasn't raised by Sven, is the big problem that we have a small proportion of the population that have a very high consumption of alcohol. And that is something that we haven't taken care of. And I think there is a lot to do in that area, how to help people that have a very high consumption of alcohol to get treatment and to get help. And I think there is a lot to do in that area. I don't know if that was in any of the presentations, but that I see as a focus area.
You will be able to come back to that in a later question as well. So we're looking forward to that. And now I think for the second question, Karin, I'll ask you first, and then the rest of you can answer the same question. What are the biggest challenges today when it comes to reducing alcohol harm? We have heard about the problems around alcohol, but what are the biggest challenges to actually reduce the harm? And how does your party refer to alcohol as a public health problem? And are there any challenges or difficulties in making the necessary decisions?
Well, that's a lot of questions in one question, actually. But I think the main task for us is to keep focus on the health issues of alcohol. We tend to talk a lot about benefits, economic benefits, and the positive effects of alcohol, but we have to keep focus on the health issues. And of course, what we talked about, cancer and 200 different diagnoses can be connected to alcohol. That we have to keep in mind. But I think if we have to choose one question, the most important is to maintain the Swedish restrictive politics about alcohol, and to keep on regulating the availability, and to keep a high price, and to keep talk about how to restrict marketing on social media, as they talked about today, because this is challenged today in many ways, not at least in the discussion about availability, when we talk about farm sales or yard sales, and the proposal that we are discussing in Sweden today about introducing farm sales, yard sales, might affect the retail or monopoly when it comes to international regulation in the EU. So I think that we have to keep focus on the same questions as we have had focus on, but we have to be sharper.
So public health is an agenda when it comes to alcohol.
Yes.
Jacob.
Yes, I think we agreed a lot of we're talking about this today, but I believe that to be able to capture all those who live in what seems a functional life while they are abusing alcohol, we don't always see who is drinking a lot. And I think a lot of those children who were mentioned, 350,000 children who live with their parents and who have used alcohol, and that's for me. It's very important to find those, to help those who are maybe hidden in the society. And we in the Liberals, we focus a lot about school, in school to help and support and also educate and knowledge. And that's a good thing in Sweden, I think, that we have worked in school with this. But we need to continue with that. And we also see a higher worryingly risk of use of alcohol among older women that we also have to address. So we need to talk about this more and lift it up like we do today. It's very important. Thank you.
And then for the second question there, are there any challenges in making those necessary decisions you need to be able to have a child rights focus or focus on elderly people?
The politics it's right, was mentioned right now. We have a big discussion about the foreign sales and the monopoly, and we in the Liberals, we see that challenge, and I'm new into this politic area, but I addressed it directly. I worked 20 years as a priest, a pastor in church, with focus to people who have very low ability to stand against alcohol. So we have those was mentioned before here that drink a lot, and that is very important for the politics, for us to focus at. To have that special group.
Thank you. Go further to Karin.
Okay, thank you. I think alcohol is a public health issue, not a market issue. That's the main thing, I think. There must be a state that stands for the policy, not the market. I think it's very important. And we need to increase information, for example, about the risk with alcohol, more than we have done the last years. And the more alcohol in a society, the more damage. We must talk about that. It's not an individual problem, it's a society's problem. Do you understand? Yeah, okay. And you can see a lot of harmful effects of alcohol affect also, for example, the kids. I mean, it's not about the parents who are extremely drunk, it's about the family, for instance, drinks that much in the weekends as a changed attitude of the children. We must start to talk about that. It affects the children in different ways. We're talking about cancer, for instance. I think it's very not that familiar in Sweden, that is such a strong link. And that I think, is that a thing for us in the politics to do something about that? And I go back to this, alcohol is a public health issue, and the discussion we have in Sweden now about farm sales, we endanger the monopoly, absolutely, and we will see a lot of harm if we can buy the alcohol in ordinary shops, for instance. It would be a catastrophe. I'm sorry, it's a catastrophe, more or less, I must say. And we must talk more about the children, I think, and raise that question. The cancer is one question, and the children, what to do about families that always drink alcohol. They're not completely out, but they are drinking and it affects their kids. That's a thing to talk about in Sweden, I think. Thank you.
Thank you very much. Anders.
I forgot to mention one positive development as well, and that is that if you had a discussion about alcohol in the European community like 20 years ago, it was only a market question. What we hear today from the European communities and several other European countries as well is that more and more are seeing it as a public health problem. And that I view as a very positive development, because if you are going to use measures such as raising taxes and so on, you have to have an agreement between the countries, and that was very clear shown by our colleague from Slovenia, who said it's not easy to raise the taxes here in Slovenia when Italy is so close, and Austria and Croatia. As I said, the main area that I think need to be focused are the 500,000 people in this country that have a very high usage of alcohol and that are dependent on alcohol. And they are the ones that suffer the most, and especially their families. And I think there has to be a lot more to do. Today, these people are referred to, if you want to have help for your alcohol abuse, then you should go to the social service in the municipality. When this is really a health issue, and of course primary care should be a lot better to take care of these people. They don't want to go to social services, but it's easier for them to go to the primary care. But the primary care in Sweden isn't ready to handle and to help these people. And if I would raise one main problem that we have in this area, I would focus that.
Thank you very much. Ulrika?
Thank you. Yes, many questions in one, but I looked at what the Green Party has said in our position papers on alcohol, and it's not very much, but what is in there is like a stressing of the monopoly as something to stick with, and restrictions in general on alcohol policies. That is in our programs. Otherwise, it's a big focus on children and how children are affected by drinking adults in their immediate environments. And it's also a statement about that marketing on alcohol products should be banned, not only in social media, but in general is the position of the Green Party. Probably not very likely to happen, but that's the position. So we can start with limiting it then in social media and also try to limit it when it reaches children. There is nothing then which is interesting on either like cancer, alcohol causes cancer or any other problems, or even costs, and it's also nothing about the environment, which was also brought up here in one of the very interesting presentations, the connections to the sustainable development goals, which definitely should be in the party program of the Greens, I think. So there's potential for developing around the alcohol positions of the Greens here. But definitely you could say that there is a focus on children's rights, how children are affected, and that restrictions and monopoly are good, and that marketing should be limited or even banned.
Thank you very much, and interesting reflections from your when it comes to your program then. And I think also highlighting we have the Convention on the Rights of the Child is now law in Sweden since 2020. So highlighting the rights of the child is of course important as well, talking about alcohol-related harm. Now, next question, and I think Karin, if you want to start.
Okay.
A new survey from Novus shows that almost half of the Swedish population thinks that too little is being done to reduce alcohol-related harm. But at the same time, the Swedish alcohol policy hasn't developed for a long time. And that means, among other things, that it's actually cheaper today to buy alcohol than 20 years ago. So why do you think that alcohol policy no longer has the same sort of priority as a public health measure?
Thank you. I think that we stopped talking about alcohol as a public health issue around 2010 or something. We had a big campaign in Sweden between 2000 and 2007, I think it was, and it was very strong and it was very successful. And we could see very good numbers after that. And then we thought, this is it, we have done everything, time to rest. And I think we should raise the health aspects again, example, cancer and alcohol, talk about taxes again, talk about the whole thing as a public health issue, an important issue for us all. And we must also again raise the issue of addiction and, for example, the children who are affected by addiction in different ways. We must start over again. We can't just look at this and say, well, it's half good, just leave it.
Thank you.
Yes, we should not forget that the young people drink not so much today as before. It's going down. We have to remember we are actually doing things in Sweden in the school that we have to continue to do. Well, we have to continue to have the monopoly. We have to continue to have high taxes. In the autumn budget, we raised the taxes now, this government of alcohol. So we have to continue doing that. But as I said in the start, we have big differences. So we have still a group in Sweden that are, I was talking to society worker this last week, and two groups are increasing. That is young women who are addicted to alcohol and drugs, and families who come to them and need have big problems. Those groups are increasing, but the alcohol consumption about young people is getting lower. So we have maybe have to focus on what new problems we have to discover that one and work with those. And again, continue working in school. That's the most important thing.
I'm actually not doing the same mistake as when it comes to other drugs, where you saw a very low consumption among young people in the beginning of the 90s, and then you thought that this was it, so we don't need to do anything more. And now it's not raising, but it has raised since 1990, when it was as low as, yeah. Okay, thank you very much. Anders?
But just to comment the last thing you said, that many people say that, oh, the positive development concerning alcohol consumption among young people, that is just because they use cannabis instead, and that is not true. We have an increase in cannabis consumption among young people, but it's not as steep down as the decrease of alcohol consumption. And you asked the question, why isn't this a big debate about alcohol today in Sweden? And I think that's because most parents, grandparents and great-grandparents, they remember the way it was when they were young, and the problem was at a totally different level. And they see that it is a better situation today than it was many years ago. And when you have a political debate concerning alcohol, it's always in the concept of ANDT. ANDT. And the biggest problem we have there in Sweden compared to other countries now is the mortality in narcotic dependency, where we have the highest numbers in Europe almost. And of course, that is in the focus of the political discussion a lot more than tobacco is going down quite rapidly, alcohol as well. So I think that is the reason why it isn't a big political debate now when we're trying to find new measures to lower the alcohol consumption.
But how do you keep the consumption as low as it is today? Because that was my point to Jacob's.
I haven't studied the figures, but I believe it is decreasing still, both among young people and also among the total population. But now it's a guess from my side. I haven't seen the figures last year. So that means that we're doing the right things, and then we just keep doing the same.
Thank you very much. I have to keep in mind who I've asked, but I think it's Ulrika.
I think there is a lot to what Anders said, that it's hard to have a political discussion when the message then is maybe keep doing what you're doing, or like it's not, and there are other issues that are seen as more pressing in the same related areas as Anders also said. I think that's maybe why it's not so much a big topic of discussion, because it's not really in media or anywhere that like alcohol consumption is a problem, and not even then with these new knowledges that we have been told about today. They haven't really reached public debates as much as they maybe should have. So that's maybe something to try to bring it up on the agenda, which to bring up this new knowledge that we now have, that we didn't have maybe 10 or 15 years ago, to try to bring on new aspects to the public discussion, because otherwise it is very complicated to say them. If you just want to keep doing what we're doing, maybe with like more restrictions from some of us when it comes to marketing, for example, but otherwise it's hard then to keep something be seen as pressing and something that you need to discuss a lot. So that's maybe why. But this new knowledge deserves more attention, I think, than it has currently, about the connections to cancer and also the environmental issues and everything deserves to be recognized much more than now.
Thank you very much. And Karin.
Well, I think like Anders said, we have a better situation today than we used to. And like Karin said, maybe we've relaxed a little bit too much. But I also think that this is an effect of individualized society, because we don't address the problems of alcohol always as a societal problem. We tend to see it like an individual problem, whether is it about violence or about assaults or about health problems. We tend to see it like the individual problem and not as a societal problem. And I think that we need a shift of focus there. It's still a stigma in some way about alcohol consumption. And again, I think that we as politicians, we need to talk about this in economical terms, because this is how we run the society, by figures. We do it by figures. We talk about health, we talk about children's circumstances when they're growing up, but we rule our society by economics. So we have to talk about the costs more than we do today. Thank you.
Thank you very much. And now a last question and very short answers. So I give you a challenge. Tomorrow we'll talk about the need of implementing an effective alcohol policy. And if you had to choose one alcohol policy measure that in your opinion would strengthen public health in Sweden, which one would it be? Anders.
As I said, that is really not public health, but that would be addressing the 500,000 people that have severe problems with their alcohol consumption and see what else we can do there. In a broader sense, it is public health, of course, but not as a specific.
I'll go with the marketing ban, or at least limiting marketing then, especially with the ones that reach young people, and also maybe start with the social media, but the limiting or banning marketing of alcohol products.
Okay, I stand up for the children. Children drink less while they are growing up.
Again, I think we have to talk about the economic costs about this, how we can measure people's suffering in Swedish crowns.
Then I would say we have to get better addiction treatment, not least for elderly people, and again, the school, for young people. Continue.
Thank you very much. We're very interesting discussion, and you have, of course, many things in common, but also different opinions, as you should have, of course. And it will be interesting to follow up with what is happening with alcohol policy within the Swedish government. You should of course get sorry, we're not leaving yet. We have closing remarks. We'd like to thank your panel on stage. Karin, thank you very much. Now, before we end this afternoon session, we have a interesting remark from Eric Carlin, who is a public health expert in alcohol policy at the WHO. So, welcome, the stage is yours.
Thank you very much, and it's very nice to be back in Stockholm. It's one of my favourite places. Thank you to all of the speakers, and thank you to the parliamentarians. It's really inspiring to hear parliamentarians so engaged with the issue of alcohol, including thinking through the challenges and how to overcome those challenges. I've said that I will try and summarise kind of key things I heard from that, and I will probably fail, but I'll try my best. I think one of the things that's really important to say is that we do know about the harm, and what was reflected in the discussion is we know about the harms from alcohol. We've 1 million deaths due to alcohol in the WHO European region. Something I didn't hear very much from the discussion was about alcohol being a global issue and an international issue. And we need to recognise that actually that we need to have international collaboration to reduce the power of the alcohol industry and its interference in public health policies. So I think we need to kind of draw on the good example of parts of Swedish policy and share that with other countries, but also we need to collaborate internationally if we're going to have an impact on the sustainable development goals and on development and reducing inequalities more generally. I heard a really kind of common theme through all of the discussion about needing to harness the economic arguments for alcohol policy. Yes, I can't say better than that. Yes, we absolutely need to do that. I also think we also need to tell personal stories, and we need to also recognise that every single one of us in this house in this room rather, must have a personal story in relation to alcohol harms. So we both need to kind of tell the story with the head, but we also need to tell the story with the heart, because every one of those 1 million deaths is totally preventable. Every one of those 1 million deaths is somebody who is a family member, a friend, a colleague. It's all preventable. It's not inevitable. We talked about the cancer, raising awareness of cancer, and that's absolutely a really important priority for us. There's no safe level of consumption related to alcohol and cancer, and the harms that often occur at really low levels. The public doesn't know that well enough. The other thing in terms of statistics are important. 1 in 10 deaths in the WHO European region are caused by alcohol. Also, 1/4 of all deaths of young people aged 20 to 24 in WHO European region are caused by alcohol. It's not hard to make an economic argument about why that's problematic in terms of lost productivity, alongside obviously the human stories. We need to challenge misinformation that we don't know what to do about this. We do know what to do about this. My colleague Vesna, and it was amazing to see her there. I share the scars on my back of some of the stories that she was talking about in terms of trying to fight to implement the framework for action on alcohol for the European region. There are 6 priority areas in this framework, and it's for countries to select which of those priority areas fit their circumstances best and which are going to reduce the harms most. I kind of flinch slightly about asking which policy do you want for Sweden, because you don't need just one policy, you need joined up policies. So you need action on the best buys to increase price, or to keep price high, to make sure that you continue to limit availability and to increase restrictions on marketing. But you also need better health services, you also need labelling. And also, importantly, you need community action. We need to be listening to communities who are affected by alcohol and engage with them to actually find solutions, and for their solutions to then be shared, so that actually that we have a joined upness between what happens at the local, what happens at the national, as well as what happens at the international level. System Boliger was mentioned several times. Just to say, you have a gift in Sweden that you have this established and accepted and popular with the people. Do not lose that. Do not lose that, because you can actually implement all these policies far more effectively through that structure than in any other way. So please, from a WHO perspective, do not lose that. And in our framework, we do talk about that other countries should be looking to where the monopolies exist and learning from them and looking at the potential for doing something similar in other countries where they don't exist. Just to say that WHO is going to be working with Systembolaget. I'm really excited to be going to kind of be taken on a tour of some kind at the weekend, which is going to be really exciting. And we're also going to be working with Systembolaget on developing and increasing the evidence base for health warning labels. We'll be developing a research project with them, testing out the effectiveness of health warning labels. I've only got 2 more things to say, and I will go quickly, but I'm really conscious if I speak too quickly with my Scottish accent, people lose it a bit, so I will not go too quickly. First of all, a negative and something that needs to be really challenged. Industry opposition. Our member states tell us consistently that the biggest impediment to implementing effective policy is opposition by the alcohol industry. That needs to be called out, and it needs to be called out that there isn't common ground between the alcohol industry and public health interests. They should be, and it's up to parliamentarians, it's up to regulators to tell them, if we're saying that this is a legal product, which continues to be a legal product, they should be told what they can do and what they cannot do. They should not be in any way engaged in discussion about developing alcohol policy and the kind of things that people say they're reading, about kind of a safe level of alcohol consumption. It's good, a small glass of red wine is good for you. We're really clear, there is no safe level of alcohol consumption, and any information to the contrary is misinformation. Finally, I want to kind of talk about young people, and this is far more positive and optimistic. Young people are the future, but they're also the present, and actually in the present, yes, at population level, young people are drinking less than before. Let's not ignore the inequality. So there are small pockets of young people who are actually drinking an awful lot and really harming themselves. So let's not lose attention, paying attention to those pockets and the inequalities in relation to that. But engaging with young people on the basis that it's a right for young people to be protected from alcohol marketing, particularly in the digital spaces, is really important. They can tell us how to do that. I don't know how to do this. I'm an old man. I don't know how to intervene in digital spaces. I don't know where young people are actually kind of being exposed to alcohol messages. We need to engage with them, and we need to engage with them at local level, at national level, and at international level. WHO is committed to doing that. We're committed to helping you in any way that we can with sharing the best evidence, with developing technical tools and guidance. And I thank you very much for the opportunity to be here with you for these few days. Thank you.
Thank you very much, Eric, for concluding this afternoon. Yes.
Thank you very much.
And thank you everyone for being here today, you in the audience, members from the parliament, the speakers of today, but also all of you who have been participating online. And I would also like to invite you to the next day, the second day of our mini conference, which will be held at the Europahuset tomorrow. And it's possible to join us there or join us online. But thank you for this afternoon. Sorry, I would like to thank you again as well for having us here. Without you, 15 so